Migraine headaches, how to treat and prevent them. Part 1, Overview of Migraine Headaches. Today on the Pharmacy Tutor channel, we will begin a new and exciting series on migraine headaches. We will go over both traditional and the recently approved newer treatments for the acute and preventive management of migraines. In Part 1 of this three-part series, we will first present an overview of migraine headaches. We'll start off by first providing some basic facts about migraines. A migraine headache is a type of headache of moderate to severe pain intensity, characterized by a throbbing, pulsating, or pounding pain sensation. Location. The pain is usually on one side of the head, unilateral, but it can often be on both sides. The pain can move from one side of the head to the other, or it can feel like it's affecting the entire head. In some cases, the pain can occur in the front of the head, behind the eye, in the face, or in the back of the head, affecting the neck area. Symptoms. What's common during a migraine headache? It's often accompanied by nausea and/or vomiting. About 80% of people have nausea, and about half vomit. It can cause extreme sensitivity to light and sound, and sometimes smell and touch. You can be bothered by an increased sensitivity to bright lights, smelling strong odors, and loud noises. And symptoms of head pain can worsen with physical activity or any movement. Other symptoms of migraine headache can include neck pain or stiffness, blurred vision, nasal congestion, loss of appetite, fatigue, feeling warm, sweating, or cold, chills, dizziness, lightheadedness, tingling in the face, hands, or feet, depression or anxiety, and insomnia. How long does a migraine last? It's common for a migraine attack to last for hours or even days. Most migraines last about 4 hours. Severe ones can last much longer. Untreated attacks can last up to 72 hours. Frequency. On average, most people experience 2 to 4 migraine headaches per month. Migraines may occur rarely or strike several times a month. How often migraines occur varies from person to person. Some people may experience migraine headaches every few days, while others get them once or twice a year. How do we classify migraines? Migraines can be classified as either episodic or chronic. Episodic migraine means having less than 15 headache days per month. Chronic migraines means experiencing 15 or more headache days per month for 3 or more months, with at least 8 that include migraine features. Chronic migraines are less common than episodic migraines and affect 1 to 5% of patients with migraines. Episodic migraines can turn into chronic in some people, especially if it's not recognized and not treated correctly. Incidence. About 12% of the U.S. adult population get migraine headaches. Women are 3 times more likely than men to experience migraines. 18 to 26% of women and 6 to 9% of men get migraines, which result in a sex prevalence ratio of 3 to 1. The incidence peaks between the ages of 35 and 39 years old. Migraines are genetic. A family history of migraine is common, with the heritability estimated to be approximately 40 to 65%. Migraines occur most frequently in the morning, especially upon waking. Quality of life. Migraine pain can be so bad that it interferes with and prevents a person from carrying out normal daily activities. The debilitating throbbing pain can leave people bedridden. In 2019, migraine was the second leading cause of disability among men and women across all age groups, and the leading cause of disability in women aged 15 to 49 years. A large percentage, about 75% of migraine sufferers, experience functional disability during an attack. Also, half of them require the assistance of family members or friends during a migraine, significantly disrupting their lives. Now let's move on and talk about the causes of migraines and its pathophysiology. A discussion of the etiology and pathophysiology of migraines begins with the concept of neuron activation. Although the pathogenesis of migraine is not completely understood, it is thought to involve the activation of the trigeminal nerve pathway and its axonal projections into the intracranial vasculature, called the trigeminal-vascular system. In the picture above, we can see that migraines begin with neurons, or nerves, being activated in the trigeminal nerve pathway located centrally in the brain. Migraine headaches are characterized by neuronal hyperexcitability caused by the activation of the brain's central trigeminal nerve sensory pathways. Here is a more specific diagram showing the location of where the migraine is thought to begin at. It is at a key region located centrally in the brain that involves the trigeminal nerve. What happens next is a release of neuropeptides. Activation of trigeminal neurons trigger the release of vasoactive and inflammatory neuropeptides into the brain's nerves and blood vessels, inducing local inflammatory reactions. Calcitonin gene-related peptide, or CGRP, is a very potent neuropeptide produced within neurons. CGRP is the main chemical secreted from nerve endings in the brain during a migraine attack, and is responsible for many of the migraine symptoms. In this picture, the irritants that are released are these potent neuropeptides called CGRP. Notice how the CGRP peptides cause blood vessel vasodilation with inflammation, as well as irritating the nerves to cause pain. CGRP also triggers the release of vasoactive neuropeptides in trigeminal neurons, such as substance P. This is a more simple diagram illustrating the migraine process. First, a nerve impulse in the trigeminal nerve ending, in light green, causes the release of CGRP neuropeptides into the nerve synapse. CGRP then binds to the receptors on smooth muscle cells located in the cranial blood vessels, in the cerebral artery, and in the meninges. Activation of CGRP receptors then leads to vasodilation, inflammation, and pain occurring. So let's review the triad of migraine pathophysiology. First, pain. Migraine pain begins with the activation of trigeminal nerve fibers that surround and innervate blood vessels within the meninges, the layers of membranes protecting the brain and spinal cord, and large cerebral arteries. Pain signals from the trigeminal vascular system are relayed to areas in the brain that yield the perception of migraine pain. Second, vasodilation. Neuropeptides produce arterial vasodilation in cerebral blood vessels and inflammation of pain-sensitive meninges, thereby contributing to the emergence of a migraine. And third, inflammation. Neuropeptide release leads to increased blood flow and plasma extravasation, eventually causing perivascular inflammation. It is this inflammation that sensitizes the trigeminal nerve cells to nonspecific stimuli, increasing pain. Here's a larger picture of the one you previously viewed that shows the impact of CGRP on blood vessels and nerves. Notice the location of the skull and the layers of meninges below it, in close proximity to the dilating blood vessels. Take a look at the boxed area marked in red. Looking closely at it, you can see how the trigeminal nerve is activated, causing release of CGRP. You can also see the dilating blood vessel located within the dura space of the meninges. The arrow marks where this is all taking place, immediately below the skull. Now you can see an updated view of this diagram showing the effects of activation of CGRP receptors, resulting in pain, vasodilation, and inflammation, and leading to the migraine. Here is a picture of a young lady experiencing a migraine aura. Temporary warning symptoms known as an aura occur before or with the migraine headache in some people. An aura is a group of sensory, motor, and speech symptoms that act like warning signals that a migraine headache is about to begin. About 15 to 25% of people who experience migraines have auras. Aura symptoms often begin 10 to 15 minutes before the headache, typically developing gradually and building up over several minutes. The aura phase usually lasts about 15 to 30 minutes, but it can last as little as 5 minutes or as long as 1 hour. Aura symptoms stem from the nervous system. Most often, the vision is affected. Visual disturbances during an aura are common, occurring in 90% of cases. They see flashes of light, bright lights, and sparkles. They see various shapes, stars, zigzag, wavy, or jagged lines that look like heat waves. They can also see bright, flashing black dots or colored spots. Tunnel vision and blind spots, temporary vision loss, blurred vision, or eye pain can also occur. Other nervous system disturbances can occur during an aura. Speech changes, difficulty speaking, not able to speak clearly, tingling, pins and needles, or numbness on one side of the body, sensations in the face, arm, or leg. Tinnitus, changes in smell, taste, or touch, or muscle weakness or numbness in the face or on one side of the body can occur. There are several categories of migraine. Migraine without aura is also called common migraine, the most common type where the migraine occurs without warning signs. Migraine with aura, or classic migraine, the warning signs occur before the migraine begins. And migraine with aura without headache, also called silent migraine. An aura or other migraine symptoms are experienced without a headache. Most people who have migraines have common migraines. Common migraines don't start with an aura. Common migraines may start more slowly than classic migraines, last longer, and interfere more with daily activities. The pain of common migraines may be on only one side of the head. There is a long list of things that can trigger a migraine. We will go over them in 4 groups. First, physical triggers. This includes emotional stress and anxiety at work or home, one of the most common triggers. Being overly tired, poor quality sleep, low blood sugar, or overexertion of strenuous physical exercise. Dietary triggers. Skipping meals, delayed or irregular meals, not drinking enough water, becoming dehydrated. Alcohol, especially wine. Tyramine, a food additive found in some cheeses and cured meat. Other food additives such as aspartame and MSG. Caffeine products such as tea, coffee, chocolate, or a lack of caffeine, leading to withdrawal. Environmental triggers. Bright or flashing lights, flickering TVs or computer screens. Loud noises or sounds. Strong smells such as perfume, paint thinner. Smoky rooms. Changes in weather or barometric pressure. And hormonal changes in women. Migraine in women is often associated with changes in hormones. Fluctuations in estrogen, such as before or during menstrual periods, pregnancy, and menopause, can trigger headaches. Hormonal changes can also be brought on by using oral contraceptives or hormone replacement therapy, which can worsen migraines. To stay updated with each installment of the PharmEasy Tutor, make sure to subscribe to this channel. It's easy. Just click on the black subscribe button below to change it to the word subscribed. Then, to get notified whenever a new video comes out, click the down arrow and then select all. Also, if you like videos such as this, please take a moment to click on the thumbs up icon below to change the color to black. Thanks for your help with this. So how are migraines treated? What medications are used to relieve migraine pain? Migraine headaches are a chronic condition. They cannot be cured, but they can be managed and possibly improved. Drugs to relieve migraine pain come in a variety of formulations, including pills, tablets, injections, suppositories, and nasal sprays. Today, the goal of treatment for migraine attacks is to provide rapid relief from pain and other migraine-related symptoms, to restore patient function, and to prevent recurrence. There are two main treatment approaches for migraines that use medications: abortive and preventive. Drug therapy for migraine is divided into two categories: abortive and preventive treatment. Abortive or acute medications are taken as soon as the migraine symptoms occur to relieve pain and restore function. Preventive treatment involves taking medications daily to reduce the severity of future migraine attacks or to keep them from happening. Abortive or acute medications are most effective when they are taken early, at the first sign of experiencing a migraine attack. By taking abortive medications while the pain is mild, they can help stop the headache process from progressing before it gets worse. Some abortive medications work by constricting blood vessels and restoring them back to normal to relieve the migraine pain. Preventive or prophylactic treatment aims to reduce the frequency, severity, and duration of attacks. Preventive medications may be prescribed when migraine headaches are severe, occur more often than once per week, and are significantly interfering with normal activities. Medications are generally taken on a regular daily basis to help prevent migraines from occurring. Summary. In Part 1, we described a migraine headache, including location, symptoms, duration, frequency, and incidence. We outlined the pathophysiology of migraines and defined what role CGRP has in the etiology. We explained what a migraine aura is and listed 5 key disturbances it causes. We gave 4 main categories of triggers that can cause a migraine. And we outlined the differences between abortive and preventive migraine treatment. What's up next? In Part 2 of this 3-part series on migraine headaches, we will learn all about the OTC and prescription medications used in the acute treatment of migraines. So stay tuned. Thanks for tuning in to watch this installment of the Farm Easy Tutor. I hope you learned something that you could use at school or in practice. If you would like to continue to see more of these types of tutorials on YouTube, please make sure to click on the black subscribe button below to change it to the word subscribed. Also, if you like this video, I would appreciate it if you can click on the thumbs up icon below to change the color to black. Also, if you have any comments or questions, please feel free to add them in the comments section below or share this site with someone else. Stay tuned to the Farm Easy Tutor channel for more lectures in the upcoming weeks. So until next time, remember to take it easy.